Okay, welcome back. Now I'm going to explain the microcirculation, fluid exchange, and your lymphatic system. So for starters, let's talk about some anatomy. Here we have an artery and a vein, and then we see the in-between with these capillaries. You need to know that arteries go to then arterioles, which then go to these capillaries, and then venules and veins. But now we have a new terminology, which is this meta-arterial. That's basically just going to be a terminal branch or a termination of your arteriole. It's called that meta-arterial. Something special about this meta-arterial is once this true capillary starts to branch off of that meta-arterial, we're going to see something called the precapillary sphincter. That precapillary sphincter is smooth muscle. Those smooth muscle fibers are going to close and open to allow blood to go intermittently allow blood to flow through. So this isn't a constant blood flow, like that laminar blood flow. This is more of a turbulent blood flow because of this precapillary sphincter. So if you relax that smooth muscle, you're gonna open that sphincter, and if you contract that muscle, you're gonna close the sphincter. This is called vasomotion. And then now, moving on from that, we're gonna have these two terminologies between diffusion and osmosis. Diffusion is going to be from high to low concentrations, and osmosis is going to be from low to high. This osmosis is mainly just water movement, but diffusion is other things. So these lipid-soluble things like oxygen and carbon dioxide can flow straight through the membrane. It doesn't need any kind of pore to go through or channel or anything like that. But water-soluble substances do need the pores in the capillaries to go through. So these are going to be things like your sodium, your chloride, your glucose, and water. The net diffusion rate of the substance going through the membrane is going to be proportional to the difference between the two sides. This is just explaining again the high to low. And then oxygen is usually going to come out because your oxygen is higher in your capillaries. So it's going to go from high to low, so it's going to get out of the capillaries and go into the interstitium, which I'm going to explain what it is in a second. And then the carbon dioxide is going to go in because carbon dioxide is higher in your tissues, so carbon dioxide is going to want to go away, so it's going to go from your tissues into your capillaries so that your capillaries can then take it away. So that's the main importance of diffusion. It's going to be oxygen out and carbon dioxide in. Osmosis, on the other hand, is going to be the water movement. So we need to know these two different concentrations. So your normal plasma protein concentration is 7.3, and then your normal interstitial concentration of protein is 2. That comes important into this whole mess of things, which I'll explain later. But we also have to keep in mind that the diameter of your plasma protein molecule is going to be greater than the width of your capillary pores. So therefore, your capillaries are impermeable to plasma proteins because they are bigger than the width of your pore in your capillary. Moving on to the interstitium and the interstitial fluid. So basically, the things that compose this interstitium are collagen fibers and then the proteoglycan filaments. So the collagen fibers are going to be very strong and they're going to extend long distances throughout this interstitium and is going to provide tensile strength to your interstitium. On the other hand, these proteoglycan filaments are going to be thin and coiled, and they're going to create this thing that's called this ventricular filament mat called a brush pile. That's important to know because in that brush pile, we're going to have 98% of hyaluronic acid and maybe 2% of protein. But this 98% of hyaluronic acid is very important because, like I mentioned, we have the interstitium, and inside we're also going to have interstitial fluid, which is hyaluronic acid and water. So all that 98% of hyaluronic acid from your proteoglycan mat, this brush pile, is going to come from there. And that's going to create your gel inside of your fluid. The fluid also has water going in there, which is called free fluid, and that's only going to be 1%. But on normal cases is 1%. But if this increases, that's when we have edema, which I'll explain in a moment. Moving on, we have the fluid exchange. Fluid exchange is defined by Fick's law of diffusion, and you're basically going to have your rate of diffusion, which is dependent on a diffusion coefficient that is dependent on what the substance is that we're talking about, and it's usually given to you. And then we're gonna be dependent on the area as well. Then, right here, we're gonna have the difference of substance from the capillary to the interstitium. This creates your gradient. So it's that high to low gradient that we have. We wanna figure it out right here. And then you divide all of that by your distance. So you can imagine that if you increase your distance, your rate of diffusion is gonna decrease because you have a bigger distance to go through. And then vice versa. If you decrease it, then your rate of diffusion is gonna increase because you have a smaller distance to get through. Then we also need to understand some pressures that are involved in this. So we're gonna have this capillary pressure, the interstitial fluid pressure, and then we're also gonna have this plasma osmotic pressure and then the interstitial osmotic pressure. So basically, this is a capillary, this is my makeshift interstitial fluid, and then this is our lymphatic system. In your capillary, like I just said, our pressure is gonna be 17.3, and then the interstitial fluid pressure is gonna be -3. Now, talking about osmotic pressure, water, we're gonna have a water osmotic pressure in the capillary of 28, and then an interstitial osmotic pressure of 8. So, what does that have to do with anything? Remember I said that osmosis goes from low to high. So if we have this low interstitial osmotic pressure and this high capillary osmotic pressure, water is gonna want to go inside. On the other hand, when we're talking about dissolved fluids and substances in fluid like proteins travel through diffusion, so it goes from high to low. So if we have this higher capillary pressure and this lower interstitial fluid pressure, proteins are going to want to go from inside to outside. So once we lose proteins, we gain water. As we lose these proteins or everything leaks, the lymphatic system is then going to carry it back into your circulation. Yes. Then we need to know this net filtration pressure. Your net filtration pressure is basically these two subtracted, and then you subtract those two numbers as well to get the net filtration going through. What does that matter? If it's positive, that means that you're going to be filtrating a lot more things. So you're losing a lot of protein, therefore your lymphatic system is carrying more stuff out. But if this net filtration pressure is negative, that means that we're reabsorbing things from this interstitial. We're not losing as much proteins, we're not losing as much water. So this is gonna go from interstitium back into the capillaries. Reabsorption is favored. Okay, then we're gonna talk about your lymphatic system. This is the last objective. So some things that we need to keep in mind that he said in lecture that he will 100% ask are factors that increase the production of lymph and lymph flow. So if we were to increase this capillary pressure, you can imagine that now we have an even higher gradient going from high to low. So this is going to increase lymph production because we're gonna have more proteins leaking out. So lymph is gonna carry more stuff out, creating more lymph and more lymph flow. Now, if we were to decrease this pressure right here, that means that we're no longer going from low to high as much. We just decreased this osmotic capillary pressure, so we're not actually taking in more water into our capillary. Water is staying here. So now our lymph is going to continue to flow because it still has to carry all of that stuff out of there to prevent edema. Another thing we can increase is the interstitial fluid. So again, if we increase this, it's gonna do what I just said. If we decrease this, no more water is gonna want to go inside. Then if we increase this, high to high, it's not gonna happen. Water's not gonna want to go inside either. And then obviously we can also increase the permeability of the capillaries, which means that the capillaries are gonna be more permeable to proteins leaving, more lymph flow. All of that makes sense. Now we get into this thing that I've been talking about, edema. What is edema? So in this makeshift little interstitium and interstitial fluid, if we have an increased amount of fluid here, that would be edema. If we have increased fluid in there, that would create a swelling, and that would be your edema. Now, and what I just said is excessive filtration and decrease lymphatic. So if we increase all of this volume here and then your lymph isn't taking it away, that will cause you an edema. Now, what can we do to prevent this? There's 3 important factors that we should know that are gonna prevent this. So this also has to do with our pressures right here. If I were to increase this pressure pressure, you can see that this will no longer be high to low. If I just increase this, this would be approximately high to high, they would be equal, so forth. Protein is no longer going to want to continue to flow out. That's going to prevent edema because you're no longer getting this increased protein going out so that your fluid doesn't build up there. If you increase this, protein won't flow out, preventing edema. Now, if we increase this, this will also promote lymph flow because since we don't have this rapid proteins going out, lymph doesn't have to stop and wait to carry that protein away. It can just carry on. We don't have that much protein, okay, bye, let's just continue the flow. Okay, so we increase this, proteins aren't gonna wanna go out, lymph doesn't want to have to work as hard to carry that lymph, so we promote the lymph flow to continue, okay, preventing edema. Now, the last thing that we should know is that this increased lymph flow is gonna carry the whatever proteins are left and it's gonna carry it away. This decrease in protein is then gonna decrease this pressure. And then if we decrease this pressure, we're gonna have water going back in and that's gonna prevent the filtration to go out because it's sucking things back into your capillaries. So it's going to reduce your fluid filtration. That all makes sense. All these three principles are dependent on edema. In his PowerPoint, he says all of these depend on the increased volume in your interstitium. If you have increased volume here, you're gonna have increased pressure. So all of these factors depend on you having some sort of edema there. If everything is normal, then everything will continue to function the way that I explained before. And yeah, I think that's it. Thank you for watching.